Good morning, and welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes, Indiana, and Chief Medical Officer of Good Samaritan Physician Network. I'm joined again today by Adam Thacker, who's our Chief Operating Officer of Good Samaritan Hospital. We're going to be talking today about the current state of COVID-19 in our local community and some policy changes that have happened statewide recently. I'll also be talking a little bit about our Back on Track program here in Indiana and how that has changed. A little bit of an update on what number of patients we have in the county, what total tests have been done, some strategies that have changed as far as testing, and some updates on recent CDC research that has been done. So just to lead off with today, 760 tests so far that have been done. We've got 25 in the county that have been positive in the past. We've got 28 that have been positive as a result of our testing through here at Good Samaritan Hospital, and currently only 3 active patients that we have had. There have been 2 new positives over the weekend, over the holiday weekend. And so many people will be asking a bit about, as we have opened things back up, are we seeing a new surge, are we seeing a new peak? And I would say, really in response to that, we've had more of a trickle that has been coming in consistently over the course of the past few weeks or so. We had a lull there for probably about 16, 17 days where we had no positives, and now we have had a few that have started coming back as a positive here and there. And it's important to realize that we anticipate that that's going to happen because there continue to be cases out there, and there continue to be hot zones of patients. And as people come in contact with them, as we are opening things up, ultimately they are going to be more positive patients. We have one inpatient right now that was one of the positives over the recent weekend, and the other positive was released back home for our typical quarantine at home. And really, all those patients that we have talked about in the past, as far as the positives have been concerned, have gone home, recovered under guidance of Dr. Stewart, and have been released back out of their quarantine. So all of that is good news. We continue to watch our local hot spots as far as things around the region. Thankfully, we've been very fortunate as things have opened up within our county. Our production plants, our factories, things like that have had excellent steps in place as far as a plan to prevent spread within their facilities, and we've been very fortunate that that has gone well. So we applaud all of the local employers and businesses for their vigilance in making sure that all of those things are in place to protect their employees. Now, one of the things that changed over the course of the past week or so is we got a little bit of a reward last week in terms of what happened with our Back on Track plan. Can you give us an update on where we're at and where we're going?
So we moved to stage 3. So if you recall, this is a 5-stage plan, and in the initial rollout, which I believe was May 4th, we were looking towards this stage 3 being at the end of the Memorial Day holiday weekend. And the governor last week announced that as of Friday the 22nd, we were going to move to stage 3, except for a few counties in the state that did not, but across all of the southwestern Indiana region, we moved to stage 3. And that really was a reward based off of how everybody has been staying diligent with the social distancing, the appropriate hygiene protocols, staying home if sick, just following all of the guidance that you've been provided by healthcare leaders across the state and even at a national level. So on the 22nd, moving to stage 3, started to open up movie theaters, and the gathering number that everybody has been following went from 25 to 100. I will add that there's not a period after that. It is still maintaining social distancing while in those gatherings, and still being mindful of all of the steps that we need to have in place. Some of the basketball fields, tennis courts, baseball, community recreational baseball practices could start to open back up, and so we look forward to movie theaters at 50% capacity, and those types of enjoyments that we've had, being able to get back to the new normal. Also, a part of stage 3, part 2, we'll call it, is that next Monday, June 1st, moves towards a summer camps being able to open up. So Memorial Day unofficially marks kind of the beginning of summer, and so summer camps start to open up next week, and people are making plans around that. Still with a lot of restrictions in place. Gyms and fitness centers also opened up. The local YMCA opened as of yesterday, actually. So we're moving in that direction. That also has an impact on Good Samaritan, as we're looking at that stage 3 was a pivotal piece to look at our visitor restrictions. And what does that mean at Good Samaritan? And we've had those questions in the past, and we'll certainly add that, having family with the patient and with loved ones to help in the recovery process is something that we recognize, and it's very important. And it's been a balance of safety versus comfort for the recovery process. So our team is meeting on that this week, and June 1st, we're looking at being able to relax some of the visitor restrictions here at Good Samaritan for inpatients being able to have visitors in the emergency department, surgeries, etc., being able to have a loved one with you to help with that process as you're getting medical care. So there'll be more information coming out as to the specifics of how that will look. It is not open visitation. There are still restrictions, but we are going to be able to relax those so long as we continue to have the positive trend with the cases that we are seeing in the community at this time.
And so that's as you stated, stage 2, part 2.2, I guess.
Yeah.
And then we have stage 4 that will be opening up on the 14th of June. And probably some of the most important things I get questions about with regards to the summer camps and then also sporting events. And so a lot of non-contact sporting events are starting to practice and opening up, and that's going to open up even more as we get to the 14th. The gathering size is increasing as well, so we frequently get people asking about weddings and church picnics and things as that as well. And that's going to 250, I think, at that time. And so all of those things are starting to loosen up, and ultimately what we are heading for is stage 5. And stage 5 is slated to be on July 4th. Again, it will be interesting to see if there's a preview to that, so maybe 4.2 as well as we get closer to that holiday weekend. But again, as we've reported all along, this is something that we're all looking at on a daily basis to see what the numbers are looking like, where the hot zones are, and ultimately we've been very pleased with the fact that our state government has recognized the fact that those of us in smaller communities, more rural settings and so forth, have very different circumstances than what places do that are larger population centers. And so we appreciate that has been a stepwise plan that has helped us.
Right.
As we march over the next few weeks or so, I frequently get asked the question as to why are we continuing to do masking? We instituted a universal masking policy just a couple of weeks ago. Many people asked, well, why had we not done that previously, and why are we doing that now? And the answer is very simple. There's more of us mixing out in the population. More of us are getting out. More of us are mingling out in society. And as that happens, it increases the chance of spread. Yeah. And one of the interesting things that came out of what we have seen as better research over the course of the past few weeks or so has been that the CDC recognized that they've really confirmed that this is very similar to, as you said, spread like flu and spread like colds, in the fact that it's respiratory droplets that get spread from person to person, and that a lot of the surface contamination and surface spread that was initially suspected, the CDC feels like that's probably not as big a role in the spread or transmission as what we thought previously.
It's possible, but it's a low risk that you're going to contract COVID-19 off of surface contamination. But certainly that droplet, which is, as we talk, breathe, interact, we are expelling droplets and could potentially contain the virus. The other thing around universal masking is we communicated, I believe, on our last Facebook Live, the Fairbanks study, and 45% of the initial participants in that study that tested positive for COVID-19 were asymptomatic. So when you have a large population walking around asymptomatic, that could potentially spread the virus, we don't know yet. Asymptomatic may mean that you don't spread the virus and you're not contagious, but asymptomatic may also mean that you are contagious. And then that 65 and older population, those with medical conditions that would put them at additional risk, are the vulnerable population that we're really looking out for. And that's where the masking comes into play. So with the Back on Track plan, face coverings are still recommended.
Yes.
So that hasn't changed. And I believe it's not until July 4th, until we get through stage 5, that face coverings are no longer even mentioned in the plan. I would suggest that that's going to continue to evolve, because there is talk about face coverings as larger events reopen. Certainly there's a lot of school discussion, and we haven't gotten clear direction on what exactly that's going to look like, but face coverings comes into play with teachers and all of those elements. So what is that going to look like going forward remains to be determined.
I think the thing that people need to appreciate also is that's relative based on where you are and what surroundings you are in. Obviously, when we are here at work, when we're not doing this, we're wearing our masks because we're around a lot of people. When people are outdoors at outdoor events and they are spread out and distributed and not within any significant contact with each other, then not as necessary. So it's important to realize that we want people to use universal masking, but also we appreciate the frustration that everyone has with wearing these masks all the time, and realize that we really want people to focus, and if you're not going to wear your mask any other time, please look at wearing it at times when you are in larger areas around more people, because we are protecting each other by wearing our own masks. And obviously the thing that we always go back to is good hand hygiene, good hand washing, and not spreading that virus and touching your face and your eyes and your mucous membrane and so forth. We have all ends of the spectrum, people that are in full body hazmat suits and wearing gloves and masks, and although that's not necessary, if that makes you feel more comfortable, that's fine. But we just want to make sure that the things that are being proven to be helpful in terms of the universal masking, that people are still vigilant about continuing to do that.
Yeah, and one thing that has remained consistent with COVID-19 and the actual organism of coronavirus is that it's relatively easy to kill. So hand hygiene would be soap and water, 20 seconds, and scrubbing your hands and making sure to cover all the area, or the hand gels that are alcohol-based and making sure that you have one that has 60, I believe it's 60% or higher of the alcohol-based, and from there, as long as you're using it appropriately and on a routine basis, if you do have coronavirus on your hands, you'll take care of it fairly easily.
Right. And so the questions we don't have the answers to. Everybody asks us on a routine basis, well, will schools open in a normal manner? And what's going to happen with my college student? Are they going to continue to live in my basement? And what's going to happen as we enter the fall? And we don't have the answers to those things, but as Adam had alluded to, the exciting thing about this taking time to progress is the fact that there's been more time for research. And so the Fairbanks study that Adam alluded to will be released with updates every month. And so we look forward to that and what that's going to mean in terms of that population of 44 to 45% of people that have potentially asymptomatic spread that were positive but never had any symptoms of the disease. The other question that we don't have an answer to yet is with regards to the vaccine. Certainly, amazing measures have been taken to accelerate the development and then potential early release of this vaccine, and we are staying tuned as to what the timeline of that's going to be. I can tell you certainly that as we were speaking with regards to those higher risk populations, ultimately, similar to what we have done when we had H1N1 come around 10 or so years ago, similar policies will likely be in place as to who gets that vaccine initially. It's obviously going to be those of our higher risk patients and populations that we are most concerned about with chronic illnesses and respiratory problems and our frontline workers and things like that. So we're looking forward to seeing how that progresses. Thankfully, we've got time. We certainly wouldn't expect a big resurgence of this until we hit the fall or into the winter months. And even if we do, we're hopeful by that time that the virus has changed and mutated a bit and has become less virulent. But those are just a couple of the questions I get hit with routinely.
Right.
Anything that you've had that people frequently hit you with?
Antibody testing.
Course.
Comes up on a regular basis, and we are moving down that road. We actually have been working with a group to have in-house antibody testing in the coming weeks. Now, the thing that remains the question mark is, what does the result mean? So if I get an antibody test, which is a blood test, and come back and says I'm positive for the antibodies related to SARS-CoV-2, what does that mean? Well, it means that I have had SARS-CoV-2, so coronavirus, and that it's been 1 to 3 weeks generally, and so I have developed antibodies. What it doesn't mean is I'm immune. I don't have to wear a mask. I don't have to do hand hygiene. I can't be reinfected with coronavirus. It may mean that, but it doesn't mean that as a definite answer, because that's the information that is still hanging out there. What it does mean is that you've had the virus, you've recovered from it, that's great, and it also means that one of the treatment modalities, which is plasma donation, is that you would be a candidate if you were interested in being a plasma donor, that you could do that for the convalescence plasma treatments. So that's what it means. If you get the antibody test and you're negative, what does that mean? It means that you either haven't had the virus or you actually have the virus maybe currently and have not developed antibodies yet, because it takes weeks after contracting a virus before you develop the antibodies. So that remains a question mark, but we do see that as an important test down the road.
Yep.
As we get more information. So our Good Samaritan lab team is working on that, and we are going to be offering that test in the coming weeks. There'll be more information coming out about how you can access that.
And one of the things that was a very hot issue for us early on was lack of tests. And I think we can say with good confidence that now the availability of our tests that we've been sending off to Mayo Clinic, and then also the rapid tests that we have had to utilize occasionally, is much better than what it was. And so we're not as concerned about that now. Right. We do have a lot of patients that are being asked by their employers to have testing done on a routine basis. And that type of source testing is still in question as to what the value of it is, but certainly a number of employers have inquired to that. And we're working with them locally to determine how we can do that, and then, of course, what's the interval for that. Right. Anytime that a test is performed that is the acute test, it's basically telling us that right now, at this snapshot in time, that you are not positive for COVID-19. Doesn't tell us that tomorrow you wouldn't turn positive, or in a week, or otherwise. And so we're going to be using those type of tests to help with kind of local surveillance to determine what the prevalence is in their community. The Fairbanks study that Adam talked about is very exciting to all of us, because it's going to be ongoing. It's going to be something that will be a random sampling of 5,000 Hoosiers every month, and that will continue to roll throughout the entire year. And as they assimilate that data and then feed that back to us, that helps us to understand that throughout our state and then locally what the prevalence of the disease is.
And June 6th and 7th is when they will be having that testing here in our area again, and we're working with the Fairbanks group on giving them a site where they can do the testing. Now keep in mind, 5,000 Hoosiers across the entire state of 6+ million, so there's not a lot of local individuals that will be contacted, but certainly would encourage you, if you are contacted via postcard or phone call asking to participate in the study, please do so, because as Dr. Stine has mentioned, that's really valuable information that we can use to continue to move forward.
All right. We'll open up to questions. Clint, our engineer today, is monitoring our system to come up with anything. You got anything for us today, Clint?
No questions today.
Okay. We threw everybody a curveball with the Memorial Day and with the holiday. With that, we certainly want to thank all of our military and all of our military families that have sacrificed so much over the years, and those that were lost defending our freedom. And thank you all for that. And we would encourage everybody to continue to be vigilant as we move forward within the next week or so. Obviously, big things happening with releases with the Back on Track plan. We'll keep you up to date with that, and we'll join you again on Monday.
Right. All right. Thank you.